What if that ache in your lower back is more than just a sign of aging, but a persistent signal your body has been trying to deliver for years? Most people over 50 dismiss it. They insist it's just a normal part of getting older. But here is the reality. It isn't age. It is adaptation. Your spine has spent decades adapting to your posture, your movements, and how you bear your life's load. And today it is demanding your attention. The twinge when you get up, the stiffness when putting on socks in the morning, the ache that persists after sitting too long. This isn't weakness. This isn't deterioration. It is a pattern, one that is reversible, retrainable, and relievable. In this video, I will reveal 4 potent, evidence-based movements that are more than just stretches. They're neuromuscular resets, and they can assist in restoring your spine's natural equilibrium, sometimes in less than 30 seconds. These are not arbitrary exercises. They are precisely selected to release one of the most neglected joints in your lower back, one that governs more mobility and discomfort than most individuals understand. Before we begin, post your name and where you're tuning in from in the comments. We would love to hear from you. Let's begin. Why most people over 50 are addressing the incorrect part of their back. For millions of Americans over 50, lower back pain is now so prevalent it nearly seems normal. But here is information your doctor might not have shared. The pain you experience is not always muscular. It is frequently in the joint that ceased to move correctly years prior. Specifically, the lumbosacral joint, the final joint in your spine, is the most likely to become stuck, inflamed, and ignored. It is located exactly where your spine connects to your pelvis, functioning as a shock absorber for every step, every seat you take, and every instance you bend to retrieve something. Over time, minor habits like poor posture on the sofa, sitting with feet up, or working from bed force this joint out of alignment, securing it in a posture it was not meant for. You can stretch your hamstrings constantly, but if that joint remains immobilized, the pain will return. We term this joint stacking, where years of imbalanced pressure compress one link in your spinal chain. And when that link becomes rigid, your brain transmits pain signals to safeguard it, like an alarm sounding even without a fire. This is why these 4 movements are crucial. They do more than just increase flexibility. They retrain your spine's movement patterns, reconnect you to your stabilizing muscles, and bring back freedom where stiffness has dominated. This concerns retraining, not just alleviating, and you are about to experience the change. Exercise 1. Prone elbow press. How to do it. Lie face down on a solid surface, such as a yoga mat or carpet. Place your forehead down briefly and breathe. Now, gradually push up onto your elbows, maintaining contact between your hips and pelvis and the floor. This is a mild back bend. You are not aiming to push up high. Just elevate enough to sense the spine extending minimally. Maintain this posture for 30 seconds, breathing steadily. If it is too much, lower yourself for a few seconds and come back. Eventually, you can work up to 1 minute and even incorporate a gentle motion. Bend one leg at a time and carefully rotate it over the other. If this results in sharp pain, proceed to the next exercise, but if it merely feels rigid or slightly uncomfortable, that is often an indication your back requires this motion. The real benefit. Most individuals over 50 are instructed to safeguard their back by limiting movement. But your spine is not a delicate stick. It is a living entity, and it is designed to move. This exercise is more than a stretch. It is a neuromechanical reset. We name it the reset position because it does just that. It counteracts the impact of slouched sitting, particularly the sagging posture that forces the lumbosacral joint into a fixed, painful state. Every time you sit slouched, this joint is squeezed and eventually your body adopts that state. This position softly informs your nervous system. We are returning to neutral. What's compelling is how quickly some people experience relief, often in 20-30 seconds. Not due to increased flexibility, but because their joint can finally decompress. Scientifically, this motion loads the spine in extension, reactivating spinal stabilizers and diminishing nociceptive, pain-related signals from compressed tissues. But here is the profound part. It hands control back to you. You are not dependent on an adjustment. You are not just doing a stretch. You are reinstating motion in the most basic joint of your spine, one that affects your hips, legs, and even equilibrium. And when performed daily, even for just a minute, this movement can silently retrain your back from chronic stiffness toward liberty once more. Exercise 2. Supine knee rotations. How to do it. Lie on your back on a bed or solid surface. Bend your knees, bringing them up so thighs are vertical and calves are relaxed. Keep arms gently out to your sides for stability. Now, slowly let both knees drop together to one side, only as far as is comfortable. Do not force them to the bed. Then, return them to center and go to the other side. Move in a slow, relaxed motion, side to side, like a pendulum. Continue for approximately 30 seconds or until you feel a gentle release. For some, the movement might only go halfway. That is absolutely fine. The aim is to gently mobilize the spine via rotation, not to maximize range of motion. This is particularly effective before sleeping or first thing in the morning when stiffness is most prominent. The real benefit: some movements do not just work your body, they reassure your nervous system that you are safe. This gentle side-to-side rotation does exactly that. We call it the gentle unwinding because it communicates directly with the part of your body that has been in a protective, locked state for years. Imagine your spine as a zipper. When the bottom is stuck, usually at the lumbosacral joint, the remainder of your back cannot move freely. Everything tightens to protect that one jammed spot. But this simple rocking motion coaxes that joint into movement, softly and rhythmically, like oiling a stiff hinge. Furthermore, it reintroduces rotational movement, which most bodies over 50 have lost from years of restricted linear habits, sitting, walking, standing. Rotation is the crucial missing element. What's remarkable is the brain's response. Your joints are full of motion sensors called mechanoreceptors. When they sense gentle movement, they transmit calming signals to your brain, lowering pain perception and muscle tightness. This is not just about stretching, it is about neuromuscular communication. Every side-to-side shift informs your spine. You are not stuck. You are moving again. You are safe. And over time, this resets your baseline. Movements that once caused pain become easy. Morning rigidity fades, and your body learns to relax instead of brace. For many of my clients, this is the first moment they feel hope. Not because the pain is gone, but because they feel motion where there was only fear before. Let's move that fear from your body. One breath, one swing, one moment at a time. Exercise 3. Bird dog with knee hover. How to do it. Start on your hands and knees, with hands directly under your shoulders and knees under your hips. Gently contract your abdominal muscles as if bracing for a light stomach tap. Now, lift your right arm straight forward, thumb up, while gently lifting your left knee about an inch from the ground. Hold for 5 seconds, then return to start. Switch sides. Left arm out, right knee hovers. Concentrate on keeping your torso stable. No rocking or twisting. Move deliberately and with control. Repeat several times per side until you feel slight fatigue, 3 times weekly. As you gain strength, you can advance to lifting the opposite arm and leg simultaneously, but only if you can maintain flawless form and control. The real benefit: here is something almost no one states. Your back pain might not stem from weakness you can see, but from deep muscles that have fallen silent. The bird dog with knee hover does not just look simple. It is one of the most neurologically potent movements for people over 50. We call it the deep core awakening because it activates your multifidus, a small but crucial muscle running along your spine, deep under the surface. After 50, especially following back pain, your brain starts to deactivate this muscle group. It ceases to fire correctly, and your spine loses its internal protectors. That is when rigidity starts, and compensations follow. The body begins using the wrong muscles for the job. But when you gently hover that knee, something incredible occurs. You re-engage the stabilizers. You do not just move, you control movement again. This exercise utilizes the concept of reflexive stability, the idea that the body can instinctively protect itself via deep muscle activation, once the correct pathways are re-established. Think of it as flipping a circuit breaker back on. You do not require massive force. You just need precision, timing, and awareness. And here is the kicker. This movement enhances not just pain, but balance, fall prevention, and walking stability, all of which diminish after 50 when these deep core muscles become inactive. You are not training for a six-pack. You are rebuilding your spine's internal defense mechanism. It is not about appearing strong. It is about being stable from the inside out. And that changes everything. Exercise 4. Standing hip circles. How to do it. Stand tall facing a wall, feet shoulder width apart. Lightly place your fingertips on the wall for balance. Do not lean. Shift your weight to your left leg, keeping it slightly bent. Now lift your right leg just off the floor. Begin to draw slow, wide circles with your knee or foot. Forward, out to the side, around, and back in. Go as slow and controlled as you can, as if moving through water. Avoid rushing or swinging. Do this for 30 seconds or until you feel light fatigue in your outer hip muscles, then change legs. As you improve, try tilting your pelvis slightly outward at the top of each circle to boost activation. This motion targets muscles vital for keeping your pelvis level and your spine aligned, especially when walking, climbing stairs, or rising from a chair. The real benefit: you have likely never heard someone say, "My back pain improved because I worked on my hip circles," but that is about to change. We call this movement the pelvic compass because it reorients your body's internal GPS for balanced posture and lower back stability. Here is the truth. The gluteus medius and other deep hip stabilizers are frequently ignored. But when they weaken, incredibly common after 50, the pelvis starts to tilt with every step. That minor tilt puts continuous torque on the lumbosacral joint, the same joint you worked to unlock in the previous exercises. And yet most people never train these muscles directly. This movement is different. It challenges balance, mobility, and coordination simultaneously, activating the precise muscles responsible for keeping your pelvis level and spine neutral. From a scientific viewpoint, it is a closed-chain balance exercise that retrains your proprioceptive system, the inner sense telling your brain where your body is in space. When that system enhances, not only does back pain lessen, but your risk of falling drops significantly. And that is important, because after 50, falls are not just slips, they are life-altering events. This exercise, when done regularly, quietly rebuilds your pelvic stability, postural control, and spinal alignment, without needing special equipment or high-impact movement. It is simple but not easy. And it is one of the most underrated protectors of your long-term independence. So yes, your hip circles might just be the most powerful move you never knew your back was begging for. Expert advice for adults over 50. Here is what I want you to remember. You are not fragile. You are adaptive. Your spine, your joints, your muscles, they have all been adjusting to how you have lived, not how you have aged. That means change is always possible, not through punishment or pushing, but through intentional, intelligent movement. Start small. Just one of these exercises, once a day, done with focus, can shift the way your back feels and functions. And most importantly, do not chase pain relief. Chase control. Because when you move with purpose, your body listens. And when your body listens, it heals. You came here looking for relief, but what you found, I hope, is something even more valuable. A way back to yourself. Pain can shrink our world. It makes us move less, trust our bodies less, and slowly start to expect less from life. But every time you choose to move with purpose, even in the smallest way, you are pushing back against that story. You are saying, "This is not how it ends. This is how I begin again." These 4 movements may seem simple, but their impact is anything but small. They speak directly to the deepest layers of your nervous system, reminding your brain that your body is still capable, still responsive, and still worthy of care. So do not chase perfection. Chase presence. Let consistency, not intensity, be your greatest strength. And if you felt even a moment of relief, a breath of freedom, or just a little more hope than you had before, hold on to that. Build on it. Let it grow. Because you are not your pain. You are not your age. You are a living, adapting, learning body. And the path back to strength is not behind you. It is right beneath your feet, step by step, movement by movement. With compassion, with curiosity, and with the quiet courage to begin, this is not the end. This is the turning point. And from here, everything can change.